Malo, Tolofa, Halo, Yakwe, Ale, Yorana, Kaselelea, and Bula, everybody. Thank you for the introduction, and thank you to ICAM for the opportunity to speak today. My name is Casey Quimby, and I'm the co-founder and managing trustee of Animals Fiji, as well as one of the co-founders of the Pacific Island Animal Advocacy Alliance, or TPIAAA. I'm also very pleased to be joined by my co-founder of TPIAAA, Dr. Jessica Hoops. Jessica is currently working as the One Health Researcher Coordinator for Animal Management in Rural and Remote Indigenous Communities, AMRIC, an Australian-based organization. Outside of her employment, Jessica has worked closely with Animals Fiji, supporting our research and dog population management work. Together, our experience in rural, remote, and Pacific Island settings, coupled with the practical leadership already being shown by TPIAAA members across the Pacific, has helped shape the Alliance focus on locally led, context-specific collaboration. Today, we'll be speaking about the development of TPIAAA as a regional alliance, supporting humane, evidence-based companion animal population management across the Pacific. While this presentation draws on our experience, we recognize and value the diversity of perspectives across the TPIAAA membership. The views shared today are our own and should not be taken to represent the views of every TPIAAA member.
The Pacific region is made up of many island nations and territories that share similar animal welfare and public health challenges, while also being highly diverse in their cultures, governance structures, resources, geography, and local realities. Oceania is one of the world's most geographically dispersed regions, with more than 20 island nations and territories separated by vast ocean distances. The region is commonly described through the subregions of Melanesia, Micronesia, and Polynesia, each with distinct histories, governance systems, cultural practices, and relationships with animals. Many Pacific Island countries face challenges associated with geographic isolation, climate vulnerability, limited infrastructure, and restricted access to veterinary supplies, medicines, equipment, and local training opportunities. In many countries, limited government resources are understandably prioritized towards human health, food security, biosecurity, climate resilience, and economic development. As a result, companion animal welfare and management often receive less formal support. Dogs and cats are common across many Pacific Island communities, but their roles vary considerably. In many places, animals are free-roaming or semi-owned, and ownership may not align neatly with Western legal or cultural definitions. Free-roaming animal populations can contribute to concerns around animal welfare, public health, livestock predation, road safety, wildlife impacts, and conflict between people and animals. This means that humane animal management sits at the intersection of animal welfare, public health, environmental management, community safety, and cultural understanding. Humane companion animal management in the Pacific is complex. It's not simply a matter of culling unowned animal populations, offering more sterilization surgeries, or building more animal shelters. Many Pacific Islands have limited or no veterinary services. Where veterinary services do exist, they are often concentrated in urban centers, leaving rural, remote, and outer island communities with little or no access to routine veterinary care. Desexing programs are often delivered through short-term outreach clinics, visiting veterinary teams, or not-for-profit organizations. These programs can be valuable, but they're often limited by funding, transport, staffing, equipment, and follow-up capacity. In many countries, there is limited baseline data on cat and dog populations, making it difficult to determine whether these interventions are actually reducing population growth over time. In addition, communities and local authorities may face pressure to respond quickly to public complaints, such as dog bites, roaming dogs, livestock predation, or even tourism concerns. This can lead to reactive approaches, particularly the use of culling and baiting, to manage dog and cat populations. While these activities may temporarily reduce the number of visible cats and dogs, they do not address the underlying drivers of free-roaming animal populations, and they can raise serious animal welfare, public health, environmental, and social concerns. Many of these challenges are shared across many Pacific Island nations, but they're often experienced in isolation, underscoring the need for avenues to support regional collaboration. Across the Pacific, many animal health and welfare organizations are facing similar challenges: large numbers of free-roaming cats and dogs, limited access to veterinary care, high costs of medicines and supplies, workforce shortages, and limited legislation or regulatory support. Despite these shared issues, organizations have historically worked in relative isolation, with few structured opportunities for regional knowledge exchange or peer-to-peer collaboration. This can result in duplicated efforts, organizations independently navigating the exact same challenges, or a reliance on externally developed approaches that may not align with Pacific realities or priorities. International organizations, donors, universities, and visiting veterinary teams have played an important role in animal welfare across the Pacific, and this support continues to be highly valuable. However, programs are generally more sustainable and effective when they are informed by local leadership, community priorities, and contextually grounded lived experience. Externally driven models may not align with local cultural contexts, the operational realities, or long-term community priorities. They also can unintentionally limit opportunities for local ownership, leadership, and long-term capacity development, and even build reliance and dependency. TPIAAA was established to help shift this dynamic by strengthening Pacific-led collaboration, knowledge sharing, and decision-making.
TPIAAA is trying to support several important shifts in the way veterinary services and companion animal population management is approached in the Pacific. The first shift is from isolation to collaboration. Instead of each organization working alone, the Alliance creates a structure for connection and shared learning. The second shift is from externally driven models to locally led solutions. External expertise is useful and needed, but it should support local priorities and strengthen local capacity. The third shift is from reactive responses to preventive strategies. Humane population management must move beyond crisis response, culling, and shelter intake. It needs to focus on sterilizing, data, community engagement, and behavior change. The fourth shift is from assumptions to evidence. Data collection, monitoring, and evaluation are essential if we want to understand what is working and what isn't. The fifth shift is from silence around difficult issues to respectful regional dialogue. Topics such as euthanasia, poisoning, antimicrobial use, and resource-limited surgical standards are difficult, but they cannot be ignored. TPIAAA creates a safe space for these conversations to happen with honesty, respect, and shared context. One of the early lessons from TPIAAA is that regional collaboration is not only about sharing success stories, it's also about creating space to discuss difficult and sometimes uncomfortable issues. Early discussions within the Alliance have included topics such as euthanasia, lethal methods of dog population control, and perioperative use of antimicrobials. These topics sit in the intersection of animal welfare, public health, veterinary ethics, cultural, law, resource limitations, and community expectations. In many Pacific settings, access to veterinary euthanasia may be limited or unavailable. This can leave animals with severe illness, injury, or neglect without a humane end-of-life option and can contribute to reliance on poison baits or other methods that raise serious welfare, public health, and non-target animal risks. Lethal population control, including poisoning and culling, is often driven by urgent concerns such as dog bites, livestock predation, public complaints, tourism pressure, or lack of practical alternatives. However, lethal control alone rarely addresses the underlying drivers of population growth. Another example is antimicrobial use in outreach desexing programs, where teams may be working with limited equipment, variable field conditions, high surgical volumes, limited follow-up, and animals with underlying disease, parasites, or poor body condition. TPIAAA creates space for members to discuss these issues in context and ask, given the local resources, cultural expectations, legal realities, and welfare risks, what is humane, what is practical, what is safe, and what can we improve on over time? The goal is not to impose one answer, but to support more humane, evidence-based, and contextually appropriate decision-making across the region. One early example of regional collaboration was the Animals Fiji team traveling to Tonga in August 2024 to support the Tonga Animal Welfare Society, TAWS. Tonga has benefited from visiting veterinary support over many years, including the South Pacific Animal Welfare, SPA, a New Zealand-based organization that has provided important veterinary and animal welfare assistance ad hoc through visits multiple times a year. What was different about this collaboration through members of the TPIAAA was the additional focus on Pacific-to-Pacific support, local partnership, and long-term system changes. Over 5 days, the team provided care for 235 animals, including 182 desexing surgeries, with support from DFAT, Tonga Police, the Ministry of Agriculture of Tonga, Food and Forestries, local volunteers, and local partners. But the value was not only in the clinical outputs. Animals Fiji brought practical experience from a similar Pacific Island context, including outreach systems, field clinic protocols, supply sourcing, and adapting veterinary care to resource-limited settings. TAWS brought local knowledge, community relationships, and a deep understanding of the Tongan context. This was important because regional collaboration works best when it's based on trust, invitation, and local knowledge, not external direction. Capacity building also happened in a practical way, through working side by side during a real program, rather than only through formal training. Together, the teams were able to deliver services while also strengthening local confidence, government engagement, and momentum towards permanent in-country veterinary capacity. Following this work, Tonga has moved towards obtaining its own veterinarian through New Zealand Aid, based in-country under the Ministry of Agriculture, Tonga. This is significant because sustainable dog population management cannot rely only on visiting teams, no matter how valuable they are. It requires local veterinary presence, local government involvement, practical capacity building, and long-term in-country systems. This kind of island-to-island learning reflects the model TPIAAA is trying to support: practical, respectful, focused on building local capacity, and grounded in shared regional realities. Early lessons. One of the clearest early lessons from TPIAAA is that trust takes time. Regional alliances cannot be built only through formal structures, logos, or meetings. They depend on relationships, consistency, humility, and practical usefulness. Context also matters. The Pacific is often spoken about as one region, but it is not one uniform setting. What works in one country, island, village, or community may not work in another. So programs need to be adapted, not copied. We have also seen the importance of safe spaces for sensitive discussions. Topics such as euthanasia, poisoning, dog meat consumption, surgical standards, antimicrobial use, and government culling programs can be difficult to talk about openly, but without discussions, there is little opportunity to improve practice. Finally, local leadership must stay central. TPIAAA is not there to prescribe one model. Its role is to support, connect, and strengthen, while recognizing that local knowledge, community relationships, cultural understanding, and lived experience are all forms of expertise. To close, humane companion animal population management in the Pacific must be understood within its social, cultural, geographic, and economic context. Many Pacific Island organizations are facing similar challenges, but have historically had limited structure opportunities to collaborate. TPIAAA was established to help move from isolation to collaboration by creating a platform for peer-to-peer exchange, sharing learning, and regional problem solving. Early discussions within the Alliance have shown the importance of safe spaces for difficult topics including euthanasia, lethal population control, and antimicrobial use in the field setting. The future of humane companion animal population management in the Pacific must be locally led, evidence-based, and supported by strong island-to-island partnerships. Humane population management in the Pacific cannot be solved by importing one-size-fits-all solutions. It will not be solved by shelters alone. It will not be solved by short-term outreach alone. And it will not be solved by culling dogs without addressing the reasons populations continue to grow. It requires collaboration, trust, evidence, local leadership, and long-term commitment. TPIAAA was created to support that shift, from isolation to collaboration, from externally driven models to Pacific-led solutions, from reactive response to humane, evidence-based companion animal population management. Our hope is that TPIAAA can help strengthen not only individual organizations, but the region as a whole. Again, thank you so much to ICAM for having us. Thank you for listening, and we look forward to taking questions.